We all have a level of mental health and well-being. It's interesting to me that if you go out into the community and we polled 100 or 1,000 Australians and said, what does mental health mean? Probably what we would think is of mental health as in the context of illness or disability. We all have a level of mental health and well-being. It's part of our overall global health. If we had a continuum of 10 feeling the best we ever did, physically or mental health or psychologically, and down that end 1 when we're feeling not so well, that's where illness and disability lives. And I guess when we say the terminology mental health, we probably think of the 5 and under rather than mental health and well-being being something that's all about part of our lives and everyone's business. So I guess that's really the difference, and we can understand where that comes from. Once upon a time, mental health in the context of that was probably around psychiatry, and the historical nature and the stigma and surrounding all of that. But if we think of then mental illness or disorder, they are set specific illnesses and disorders that have set criteria that psychiatrists and other clinicians will look at the different symptom profiles and make those diagnoses. The best way that I try and describe it for people is think of physical health. There are physical health conditions, for example, like diabetes, where we have increased blood sugar levels. Now, I like ice cream, so if I had some ice cream, my blood sugar level would go up. That doesn't mean that I have diabetes. If I'm running around and I'm short of breath, that doesn't mean I have asthma. Those are specific illnesses with symptom profiles, and so are some of the mental illnesses and disorders, specific anxiety disorders, depressive illnesses, psychotic illnesses, and those types of mental health conditions. So I guess what we then have underneath that is psychological distress, and we can all experience psychological distress that will either impact on our mental health and well-being or be part of a mental health condition or illness or disorder. Probably one of the things I hear the most from families is, or the questions that we're asked are things like, does my child have a specific mental illness? Like, does my child have bipolar disorder? Does my child have schizophrenia? And I guess some of the language and terminology around that, as if we look at those types of mental illnesses, bipolar disorder and schizophrenia affect about 1% or 1 to 2% of the population. So so we call that a low prevalence disorder. So only a small number of people are affected by that illness. However, we do know that it has a high impact on people's lives, so we shouldn't minimize that in any way. But the majority of the young people that we care for in acute mental health services, not only a small percentage of those will go on to have a lifelong mental health illness like bipolar disorder or schizophrenia. What we predominantly see are young people who experience significant emotional dysregulation, where essentially in their life at that time, they're not able to manage the amount of stress in their life with their baseline toolkit of coping and resilience. And so what they do is they experience increased intensity and frequency of episodes of distress. And the higher that distress, up at that acute level, we then see a manifestation of associated high-risk behaviours such as suicidal behaviour, self-harm, aggression, violence, and those types, absconding, running away. Young people putting themselves at risk because they're not able to manage at an emotional and psychological level in that moment. So it's in my line of work, working in acute inpatient units with young people. I might be working with young people with specific anxiety disorders, depressive illnesses, major depressive disorder, psychotic illnesses, different types of eating disorders, and even working in that acute mental health setting. Irrespective of the age, the gender, the illness that the young person's been diagnosed with, I respond to them always in the same way around their psychological distress. Essentially, my job is to determine if this child in this setting is doing well and coping, to leave them be and connect with them, but if they're having an episode of psychological distress, then I connect with them and help them to manage that episode. And if we can continually do that, that will also help them with their recovery if they're experiencing a mental illness or disorder. And that's why we coach the TAR3 and the Connect to Cope frameworks to help any adult know how to support a child in any moment.